want to be forever young? Do you really want to live forever?
One life,
forever,
one love,
and ever.
one soul.
Today's July 17th, 2019. I'm BrentNally, and I'm here at the SENS Research Foundation with Aubrey de Grey.
Thanks for having me.
Thanks so much for being here and taking the time. I really appreciate it.
It's my pleasure.
And SENS is the amazing research foundation that Aubrey co-founded in 2009. Is that correct?
That's right, yes.
And what does SENS stand for?
It stands for Strategies for Engineered Negligible Senescence, but we don't make too much of a fuss about that.
Exactly. So really appreciate you taking the time. This is awesome because I've been following you mainly on YouTube. I watch a lot of your lectures and interviews like this for definitely over a decade. I don't remember exactly when, especially with the internet, because you can go back and watch things from so many years ago, which is what makes this so cool. But I want to get into all sorts of things today, and I want to talk about primarily what's going on right now in July of 2019. Mm-hmm. So in preparation for this interview, I tried to watch some interviews that I've watched of yours from the past. You have some amazing ones that I really like. I watched the Joe Rogan one over again. I really liked your one with Brian Rose on London Real because I like that format, which is why I'm doing it like this. But I also watched some of your most recent ones that you've done within the last 3 months. So I feel like I kind of have an up-to-date information about what you've been talking about recently and where we are. But I want that to translate to the rest of the internet and the audience here.
Got it.
So we'll start off. I mean, how are you feeling in 2019 from where we are compared to 2000, 2005, and where we're going?
Well, things have changed pretty fast over the past few years, to be honest.
Yep.
And in a very good way. I guess, there's a lot of things I could point to. I guess the single biggest thing is the emergence, and indeed the explosive emergence, of the private sector involvement in what we're doing.
Right.
Because until certainly 5 years ago, perhaps even a little less, there was basically none of that. There was us, grinding away, doing what we could with obviously a very small amount of money. We have still only a budget of less than $5 million per year. But basically just, doing our best to push these very challenging research projects forward so as to eventually get to a point where we could actually repair various aspects of the damage of aging. And then, one by one, people with proper money came along, and in general they wanted to invest rather than to donate. Now this of course had happened before, but when we told them where the projects were, it just, wasn't good enough for them. They couldn't see a value proposition there. Whereas, as time went on and we got the projects a little bit further along in terms of proof of concept, that began to change. And so now we have spun out half a dozen of our projects into startup companies. And of course these companies have been able to attract very much more substantial financial support than what we could ever provide them philanthropically. Because the fact is there are a lot of people out there who are just not very fond of giving money away, but they're perfectly happy to to engage in rather high risk, high reward investments. And they also have the vision. They understand that this is actually a really big deal, both in terms of humanitarian impact and also in terms of potential financial gain in the long run. So, this is very, very heartening, and it's even better when we look a little bit more broadly. It's not just our spin-outs. It's also that dozens and dozens of companies now exist that have emerged independently of us, but with very closely aligned research, philosophy, and trying to do things that are very much, in the SENS framework. And I'm still right at the center of all of this. Everyone's coming to me to get connected to potential investors, but also the investors are coming to me. When someone's getting into this area and they're not in biotech yet, but they want to get into this, they realize how big this field's going to be, they don't know who to talk to. So they'll come to me to get a sense of where the good investment opportunities are, where the right places are to get proper due diligence advice, things like that. And so I'm making a lot happen right now.
Which is why I'm so honored and appreciative that you're taking the time to do this. It really means a lot, and You just said it all. Those were some great updates for me personally. I'm sure they're also great for the majority of the people watching. A few things to point out. So I didn't properly introduce Aubrey. He's pretty much Aubrey, the man, the myth, the legend. So there will be people watching probably on my channel who will be introduced to you for the first time, particularly some people who might follow me from cryptocurrencies or stem cells or maybe some friends and family. So you have spearheaded and pioneered this probably more than any other person on the planet. And we could probably even remove the word probably. Even people like Bill Andrews, who I've interviewed recently, have who have been maybe at this game decades even before you, can admit, and not even admit, they are happy to say that like you're the person who's taken this the furthest. And I think the reason why is it's so obvious that you're just so driven. You're doing this every day, every waking hour, and you were so gracious to sit down with me.
Well, let me say something about that, because, I mean, of course, yes, I am driven. I am very committed. And I have been able to get myself into this position of quite considerable prominence in this field so that I am able to make a big difference. And, partly it's because I'm smart and partly because I'm charismatic and determined and all that.
Right.
But I'm not exceptionally any of those things. I've just been able to put them together in a useful way. However, I do want to point out when it comes to being prominent and, being on stage and on camera a lot, that another really important thing that's happened recently is the emergence of other people who are also really good on stage and on camera and have a different kind of style. Because, I've always felt, I'm very good at what I do, I think, but I only do what I do. I have a particular way of way of saying things that, resonates with some audiences and not with others. And so I've always felt that an absolutely imperative thing that we needed in this field was diversity of messaging. Of course, people saying things that were correct, both scientifically and in terms of, answers to concerns that people might have about this mission, but saying it in ways that resonated with other audiences. And you mentioned Liz Parrish, whom you interviewed just recently. I mean, I would put her right up there as one of the most important people right now. She's done things in terms of her own self-experimentation that have, one can argue pros and cons with regard to the scientific validity and or wisdom of that. But that doesn't really bother me, because the fact is what that has done is it has given her a platform which she is using in ways that I could never do. She can pull
You're not a beautiful woman with blonde hair. So
well, it's not just that she's she's good to look at. It's that the fact is she can pull heartstrings in a way that I will never be able to do.
And she has, you have a computer. So I should give you a little bit of an intro. Obviously, I'll have a Wikipedia link below. I also want to mention that there will be show notes below. This is going to be a rather long-form, unedited interview. So check the description below, and you'll see show notes of broken up parts of our conversation. And in there, we'll have links to your Wikipedia, SENS' Wikipedia, all the other things you've been involved with. I want to spend this time talking about relevant things than just going over the little laundry list of accomplishments that you've done, because that could fill up a full 2 hours for those that don't know. But since you brought up Liz, it's a really good time, because I wanted to ask anyways, what do you now believe? Do you have any updated beliefs on, I know there's been a long debate between you and the people on the other side, like Bill Andrews and Liz, and I'll be forthright, I'm more on that side regarding telomerase and its role in cancer, and does it cause cancer or not, and obviously it lengthens telomeres. I've been taking TA65 for years. I know it's not doing a whole lot, but I started in my 20s. And my telomere measurement in 2013 when I was 28, according to LifeLength, showed me a biological age of about 21. And I haven't done it yet. I haven't done it again because I'm quite frankly scared. I haven't been living as healthy, working too long of hours and things like that. But, Liz and her results, first of all, I'll ask, do you know what her kind of results, have you kept up to date with her story?
I haven't kept fully up to date in terms of how much she's got in terms of monitoring, in terms of latest data on herself. But of course, the general telomere story, as you say, it's still one where the jury is out.
Right.
And I think it's one thing that's very important to appreciate, and this is true across the whole of science, of course, is that the kind of the headline, soundbite opinions that you may see people like myself or Bill putting out, of course, massively abbreviated, and in fact the distance between his opinion and mine is far smaller than it may appear at first sight.
Right.
So he totally accepts, same as I do, that we just don't know whether in the long run stimulation of telomerase and maintenance of telomere length will be a good thing or a bad thing. And in fact, I think we can both agree that the chances are it'll be a bit of both, and we will need to determine which way to go on the basis of what other therapies exist that, when co-administered, may tilt the balance one way or the other. For example, it's perfectly clear that if we had a fantastic, completely wonderful way to eliminate cancer that had nothing to do with telomeres, then we could play much faster and looser with telomere elongation and the consequent regenerative improvements that would occur. And in fact, over the past only 6 or 8 years, we have seen the chances of such a miracle cure for cancer actually happening rise dramatically as a result of the breakthroughs that have occurred in cancer immunotherapy with checkpoint inhibitors and CAR-T and such like. And that is, of course, continuing. We have not seen the end of that revolution. So, who can say?
Very brilliantly stated. I want to point out a few details that a lot of people might not know, and then also kind of bring you up to speed just from literally last week from what Liz has stated.
Right.
I haven't actually seen these results, so that should be really important to point out, but I also personally trust Liz. I think that she's an ethical, moral person, and I think you probably would agree with that.
Totally.
I don't want to put words in your mouth. But
Totally.
So what we went over last week when we sat down with her is that she had her telomeres tested before she had the telomerase gene therapy and the myostatin inhibitor gene therapy in Bogota, Colombia in September 2015. It unfortunately showed her telomere length at about 65 years old of a biological age when she was 45 at the time. Since then, she's had her telomeres tested 3 times, about 6 months afterwards, in early 2016, showed a biological age of, I believe, around 45-ish, so it kind of brought her back to her true chronological age. And then the most recent one she did, I don't remember exactly when that was, she said it might have been a few months ago or so, had her at a biological age of 30. Now, we all know telomere testing has its own type of, that's a whole area of disagreement within science. So it was LifeLength who she used to have her telomeres tested. And then another one, I just listened to it last night, and I cannot remember the name of it.
Well, LifeLength are good, no question. They're doing good.
Right.
They have a good method.
The other one's a reputable telomere testing company as well.
Maybe telomeres?
No, it was not telomeres. I personally don't think they're as reputable. Thank you. It was not them. I thought they started with an S, but we don't have to waste a whole lot of time on that. But she had other biomarkers done before and after as well too, blood work. She's showing, without going into a bunch of detail, they're all showing positive improvements for all the things that we know are associated with damage and aging. So I generally think that that's very positive, and I think that she is just a pioneer and a trendsetter. And she also announced, Bill Andrews kind of broke this in an interview I did with him at Sierra Sciences on May 30th, that there would be another person who was scheduled to do the telomerase gene therapy. This individual is staying private, but they had Alzheimer's, very late stage. Again, I interviewed him May 30th. It was scheduled to be done in June. And then Liz confirmed last week that this did occur, again, privately. And we now know somebody else has done the telomerase gene therapy according to Liz. And so we will just see. I think it's good to at least have these people be educated. They're choosing to do this, and then we'll just see how it goes from here. So rather than just testing mice and things that we've been doing for so many years.
I mean, actually, that's becoming a very clear trend within the field overall, within the whole of the biology of aging. People trying to find ways to use humans as the lab rats in one way or another. And of course there are many different ways that one can do that. A lot of it is in silico, in other words, basically mining the vast amounts of data, including longitudinal data on the same people being studied over decades that exist from various studies that have been going on for a long time, and using, of course, new methods of machine learning to extract patterns and actual information from that data that could not have previously been done.
Definitely. I mean, I've been a big researcher in centenarians, super centenarians, obviously. So I should mention, quick background on Aubrey. He got a BA in computer science in 1985 from Cambridge. So he has a strong computer science background. I believe you started programming when you were 15 years old.
Yep. And
you also then were awarded a PhD in biology from Cambridge as well, and now you're a biogerontologist is how you refer to yourself as your profession, correct?
Sure.
And so just so that some people who aren't aware of that, and so also for people who don't understand or know what gerontology is, it's just basically the study of the disease of old age and things that happen to people in their old age. And so that's what you spend your time focusing on. Obviously, this isn't my full-time job, but I'm 34 now. I've been doing this since I was about 19 when I had a health scare. I just hopped on the internet. I grew up on the internet, and I was just like, how do people not know this? This seems to be incredibly obvious that as we get older, more and bad things happen. You've told this story a number of times. I'll give you an opportunity to tell your story here briefly, if you'd like, about how you always kind of just realized this. You thought this was so obvious that aging is bad, and you thought everybody else knew that, and it wasn't until you got a little bit older and had some life experience and you realized that, no, everybody doesn't really realize this.
That's right, yeah. I mean, I always knew, even from when I was a young kid, that what I wanted to do with my life was to make a difference. And I understood pretty early on in my teens that the people who made the most difference in the long run were scientists, by virtue of discovering new ways to manipulate nature for the public good. So yeah, I started programming, as you say, around the age of 50, and I found I was pretty good at it. So I thought, well, okay, so out of all the various big problems that humanity has, which one am I best equipped to make a difference to? And I recognized very much that what one wants to do is to exploit one's own skills. So I thought, okay, I'll do what programming is good for. And of course the answer was the problem of work. The fact that, so many people have to spend so much of their lives doing stuff that they would not do unless they were being paid for it.
Right.
And the way to fix that is automation. So what I wanted to do was work on artificial intelligence research. And that's what I went into. As you say, I did my undergrad degree in computer science. And then I spent, I'm going to say, 7 years working in artificial intelligence research. I was pretty successful there. I definitely learned how to work on really difficult problems, which is, of course, what research is all about. But during that time, I met and married a biologist. And she's a lot older than me. She was actually already a full professor at UC San Diego, and she was on sabbatical in England. And through her, first of all, I accidentally learned a lot of biology, because I'd actually given up actually learning biology in a formal sense when I was 15. So yes, I learned a bunch of biology, but also gradually, over a period of years, I began to realize that we were never talking about aging. And I started asking questions about this, and I would say, are you interested in aging? And she would say no, and I would say, why not? And she would say, well, it's just decay, isn't it? What fundamental truths are you going to discover about nature by studying decay? And I would say, well, sure, but it's bad for you. And she would say, well, that's kind of not my problem. And I would say, well, it kind of is.
It's kind of everybody's problem.
And that was as far as I would ever be able to get. So it was really at that point only that I realized a couple of things. First big general thing, the profound difference in mindset that exists between basic scientists on the one hand and technologists on the other hand. So the difference, I mean, is that basic scientists are all about understanding nature. Their training, their inclination is all about identifying ways to extract more information, more knowledge about how nature is. Whereas technologists are all about manipulating nature. And the way of thinking that exists in the two different skill sets is completely different. Basically, it's the way you use the information you already have. Basic scientists are all about identifying the most direct evidence for this or that hypothesis so that they can be able to design a good experiment and not be misled by the results. And technologists are all about something very different. It's more like leaps of faith, really, identifying ways to put 2 and 2 together and make 17 and get a new thing out of what they already know that's more than the sum of its parts. And so I thought, well, I better switch fields, really, because, the problem I'm working on is important and I'm making progress, but this other problem of aging is far more important, and it appears that nobody's doing it, because it wasn't just my wife, you see. It was like, every biologist that I was meeting had the same view. And I found out that there was hardly anyone working on the biology of aging, and the people who were working on it weren't doing it very well, as far as I could tell. And plus also, there was no respect. The biology community in general used to regard gerontology as a bit of a haven of mediocrity, and it was a real backwater. So I got into the field, started going now, because I had this very convenient situation back then. I was working at the University of Cambridge as a research associate in a bioinformatics project, which actually was a really uninteresting project. And the only reason I'd taken the job was because it was very undemanding, and it gave me lots of spare time, as well as, of course, access to the university facilities. So I'd taken it in order to be able to pursue my artificial intelligence research in my spare time, so that I didn't need funding for it from external sources. And so all I really had to do was to repurpose my spare time and create a whole new career for myself, and I was earning enough that I could pay my way to conferences, because, of course, back then I wasn't being invited to speak. And so I started to get known in the community. I published a few initially perfectly harmless things that were well received, and I was a proper member of that community. And it was by the year 2000, when I'd been in the field for about 5 years, that I started to become a real troublemaker.
And I like troublemakers. Just real quick for me, I moved out to Silicon Valley from Kentucky, is where I'm from. About 11 years ago, and I've been at different startups, been through 3 acquisitions, and then now I'm into Bitcoin and cryptocurrency. We'll get into that in a little bit, and how that relates to human longevity, and how the two fields not only relate but should be working together a lot more, because we're more strongly correlated than a lot of people realize. So I want to point that out. And my audience, hopefully with some crypto and some, stem cell, whatever, anti-aging people, can kind of come together and understand that. But first of all, thanks for mentioning that. And I want to point out in the description below, The Immortalists is a great documentary with Aubrey and also Bill Andrews. It's about 6 years outdated or so, but
something like that, yep.
You guys do touch upon the telomere and telomerase debate a little bit in there, and it's clearly still ongoing, and probably will be for a while.
I think so.
But I want to give that a plug. It's a great documentary. Are there any other documentaries that I'm not aware of that you've been in more recently, or ones that are upcoming that you can mention or plug?
Not documentaries per se. I've done, obviously, as you said earlier on, I am on camera all the time, but it's mainly just regular interviews.
Okay, got it. And I love them, and hopefully this is valuable to people getting the up-to-date information. So why don't we pivot and jump to that right now?
Sure.
So as I mentioned, it's July 17th, 2019. You mentioned earlier that investment has been changing. That's really exciting. For many, many years, I'd watch and I just wouldn't understand, as I've gotten older and I'm, personally become more of an investor and understand more about investing, I totally get it. First, you have to have people educated to want to invest in something, and I think you have done probably more than anybody to get your average, multimillionaire or billionaire an outlet to find information to understand what the heck they're investing in. And then I think you've also helped develop some of the technologies, as you've mentioned, to get to the point where, okay, not only am I educated now as a potential investor, but it looks like this is actually probably going somewhere. And then also the economy is doing pretty well now. So you have a lot of billionaires here. For those who don't know, we're in Mountain View. It's Google's headquartered right down there. We're in Silicon Valley. So there's just money being thrown around everywhere for the most part in certain ways. So what are some of the most exciting specific projects that you can talk about that are spun off from SENS, and that maybe I'll also mention real quick, you're not working on everything, and I'll let you go into your spiel on that as well. You're not working on everything regarding aging, because there's other things that you feel can be worked upon by other projects better. So I'll let you talk about the things that you guys are working on, and then B, why you aren't trying to work on everything.
Well, actually, I'd like to do it the other way around, because it gives more context.
For sure.
The main theme that we pursue here that distinguishes SENS Research Foundation from most organizations working on aging is that we're focused on regeneration, on rejuvenation. In other words, on actually turning back the clock rather than just slowing it down. And that has been really the essence of my philosophy of going about tackling aging since the beginning. But initially it was a very hard sell. People would think, well, they would think it's obviously going to be easier to slow things down than to turn them back, and therefore let's worry about turning them back only when we've had real successes in slowing things down. And I realized, just looking at things as a technologist, I guess, rather than as a basic scientist, I realized in the year 2000 that that actually isn't the case at all, because the process of slowing aging down essentially constitutes making our metabolism run more cleanly. In other words, generate damage at a slower rate than it normally would. Because that's what aging is, of course. It's the lifelong accumulation of various types of damage in the body, various molecular and cellular changes. And that's initially harmless because the body is set up to tolerate a certain amount of that damage. But eventually there's more than that threshold amount, and that's when we start to go downhill. So yes, if we can slow down the rate at which the body generates damage, then we can postpone the health problems of late life. However, problem is, of course, that in order to do so, we would have to understand our metabolism really well, so as to tweak it so that it wouldn't be doing the thing we don't want it to do, without having unintended consequences that stop it from doing things we need it to do. And that is just not going to happen because metabolism is just too complicated. In my talks I often show a portion of a metabolic chart, which is a snapshot of a small subset of what we understand about how the body works, which is, of course, a gross understatement of the severity of the problem because it ignores all the stuff that we don't understand. So the approach of repairing damage, in other words, turning back the clock, is far easier because the damage that accumulates, as I mentioned a moment ago, is harmless at first. It's only problematic when there's too much of it, which means that until there's too much of it, it's not kind of participating in metabolism, it's just accumulating silently. And that's handy, because it means that if we have therapies that target it, then we're not interfering in this horrible network of stuff that we don't understand. We're just allowing that network to carry on for longer than it would otherwise be able to, doing what it's been evolved to do. And so it's actually a much easier approach. And it took me years and years really to get my colleagues within the biogerontology community to really understand the logic of what I was saying. But eventually it's happened, and now people are reinventing the idea in their own words, all over the place, so it's become very much the mainstream orthodox way of doing things. However, the fact is there are still some kind of shortcuts that one can take. In particular, there are ways to exploit one very important feature of metabolism, namely its adaptability to famine. So, of course, in the living world, all organisms are subject to a variable rate of availability of nutrients, of food. And they have to accommodate that by optimizing their metabolic priorities, so to speak, to cope with this. So, for example, in a famine, a typical organism will shift metabolic resources away from reproduction, just won't reproduce because there's no real point, because if you did, then your offspring would starve before they had the chance to reproduce themselves, and shift that resource into hunkering down and minimizing the rate at which the body ages. So we see that in the laboratory, of course, in mice, in rats, and in shorter-lived organisms. Turns out it's not very effective in long-lived organisms. No surprise, actually, from an evolutionary perspective, because long famines don't happen very often, and therefore the evolutionary pressure to respond to long famines is less than it is for short famines. But nevertheless, it certainly seems to have some effect, and so, of course, people are very interested in trying to make this available to people, and one very important approach to that is to try to invent drugs that can trick the body into thinking it's being starved when it's not, because people like eating. This is the problem, you see, and that's been reasonably successful. So there are quite a few companies as well as research institutions that are heavily focused on that. But we don't do that. And as you say, a large part of why we don't do it is because plenty of other people are. Now, within the damage repair strategy, there's a wide variety of different things that have to be pursued, because of course there are lots of different types of damage in a complicated machine like the human body. And the way that I've been always inclined to describe this is by classifying these many, many types of damage into 7 major categories, which is useful because within each category there may be lots of examples, but there's a generic approach to fixing all of the examples within a given category. So one example is stem cell therapy. The category of damage that is designed to repair is cell loss. In other words, cells dying and not being automatically replaced by cell division. And that, again, is something that we don't really work on much, but that's simply because stem cell research has been a very established and thriving discipline since before SENS Research Foundation even existed. And so, again, everything, or almost everything, that really we feel needs to be done is already being done by others with other sources of money, and so it wouldn't be a good bang for our buck to be putting another drop in that ocean. But pretty much everything else within damage repair is very much something that we've focused on because we have seen that it's being neglected by other groups for various reasons. Either they didn't really understand that this was an important thing to pursue, or more often they understood very much that it was important, but rather they felt that it was too difficult. Now, when I say too difficult, I want to emphasize what I mean here. It's not that these scientists are in any sense like not courageous or aren't able to understand that difficult things are worth it working on. It's really a funding problem. The fact that almost everybody, in fact pretty much everybody except me in this field, is subject to the vicissitudes of peer review. They have to go to the government all the time and write grant applications and try and get the government to give them money so that they can get their research done. And unfortunately there's never enough money, which means that the panels of scientists who decide who to give the money to and who not to are always doing so. They're always desperately looking for reasons to say no, basically. And that means that the people they say yes to will be the people who can demonstrate in a very, very overt way that they are likely to succeed with their next project, which generally means that they have plenty of evidence that they have succeeded in the past, which is measured, of course, by publications. Mm-hmm. So unfortunately this means that all scientists pretty much have to publish all the time, like every 10 minutes, in high-profile journals in order to get their next grant application funded. And that unfortunately means that the work that they do has to be low-hanging fruit. It has to be stuff that can actually deliver publishable results quickly, which of course is antithetical to the problem of working on really difficult problems. So we here at SENS Research Foundation are not constrained by that. Our funding is purely for philanthropists who understand what we are supposed to be doing and who basically trust me to make good decisions about what to fund. And so we publish, certainly, when we have something to publish, but we do not determine what we're going to work on the basis of that. And so we certainly don't publish nearly so much as what a typical university research group would do, but that's not a problem.
I love it. For the folks who are my longevity, long time, not mine, but people who've been in this game for a while, they probably followed and understood and have heard you say some of those things before. But as a translation, or let me kind of say that back to you.
Sure.
In a shorter, more layman's terms, the way that I understand it for some of the audience who might be seeing you or hearing you talk for the first time, that the big problem and how this kind of ties into crypto and governments, in my opinion, Bitcoin and stuff like that, is that when you mention low-hanging fruit, that's what all the scientists are doing to publish to get funding and to attack what they see as maybe not necessarily the biggest problem in aging and diseases in general, but it's what they're doing to get money.
Right.
And you're not in that, SENS is not in that area of, they don't have that problem because of the investors that you have. You're not constantly trying to get money from the government.
The donuts that we have.
The donuts that you have. And we'll get into investment and what's coming in and who your investors are soon, whatever you can say. Mm-hmm. But the way that I think that crypto has already helped, and I want to get an update on that, and why it is so important in general to help the planet, is because I personally believe that central banks are exactly what they say they are. They are centralized, which is communism, basically. Like, you can call it whatever you want, but it's kind of the same word. I'll get disagreement on the internet about that, but that's the way that I view it, because you're having a small entity, the Federal Reserve in the U.S., control the monetary, supply essentially, and then you have big government entities, whether it be the federal government or whether it be state and local governments controlling what's getting funded. And it's great that we have these governments funding, but they're not funding the right things. And that's why it leads me to, it's so important, in my opinion, for these big institutions, the federal government, state governments, to understand that aging is really the disease. And we can talk about it. It might not be a disease as far as, what you like to say, typical things that people think of diseases, like communicable diseases, but it really is the thing that's killing us all. And so I'm going to say one more thing, then I'll shut up and let you talk. I'm trying to piece this all together for people who are new to this. Aging and age-related diseases cause about 100,000 deaths per day, right? That's something that you've been very vocal about. And so it really is the biggest problem on the planet. You were doing computer science because you thought that it was the second biggest problem on the planet, people doing monotonous jobs they don't want to do, wasting their time. Now that we've done better on that, people are complaining like, oh, what are we going to do for jobs? And, the politicians come in and they tell you, oh, we're going to get you better jobs by doing this and that. But we don't really want to be doing stupid shit all day. We want to be doing things that we enjoy and that give us value and meaning to our life. So hopefully, I know I've kind of ranted there, but I'm trying to piece all this together, and I'm trying to explain why it's very, very important for you to share this information and get this out to people, that aging is really the biggest problem on the planet. And if we can convince governments that it's the biggest problem, then we won't have to rely on SENS getting private investment from super wealthy people. We can actually have tax dollars of not just the US, but the whole planet going towards the biggest problem on the planet. So I tried to state that the best that I could. I've been trying to piece this all together.
Sure.
Hopefully that makes sense. I know it makes sense to you.
That's pretty accurate, yeah. I mean, let me first of all deal with this fraught question of whether aging is a disease. A lot of people, like to say that I think that aging is a disease. And, I think one has to be very careful with that. In fact, I think that it's a generally bad idea to use the word aging and the word disease in the same sentence, whatever the sentence may be, because every way that you try to describe the relationship between those two things is, fraught with too much baggage, basically. So, is aging a disease? I'm not really sure. In fact, I would go so far as to say that it's a meaningless question because it depends on what one's internalized definition of the word disease is. I believe actually that it would be useful if we were to narrow the definition of the word disease so that it only encompassed things that go wrong with people early in life, through early adulthood, whether it's communicable or congenital. And that everything that only affects older people should be viewed as part of aging. The fact is, at the moment, it's hugely problematic and counterproductive that we have this intuitive separation in our heads between aspects of age-related ill health that we call diseases and aspects that we don't, that we call aging itself, frailty and sarcopenia and things. Because that kind of gives the implicit impression that the things that we call aging itself are in some way off limits to medicine. And we shouldn't even be thinking about using the word cure on these things. So we have to understand that the biological distinction between these two aspects of health problems of late life is non-existent. There is none. And we should accept that the only distinction is between the aspects of aging that we've chosen to give disease-like names to and the ones that we haven't. Once we do that, then it becomes much easier to look at aging in a demystified way, to understand that we do actually not have to view aging as any kind of enigma, and that we actually understand it pretty well already, and therefore we can be rational about the design of ways in which we might feasibly be able to do something about it. Now, if we look at the value of it to society, you're quite right, there's 100,000 a year, in fact, a day, sorry, more like 110,000 now. It's up around more than 70% of all deaths worldwide.
Can you just repeat that and say that again louder? Because I really, there's going to be some new people watching this who aren't familiar. This is just mind-boggling. People need to know this.
Yeah, I mean, if we look at the total number of deaths worldwide each day, it's nudging 160,000 now. It's around between 155 and 160. And about 110,000 of those deaths, in other words, around 70% or maybe even fractionally more, are to do with causes that do not affect young adults or kids. They only affect older people, which means they are parts of aging. So it's unquestionably the major source of death. But more than that, of course, the thing is that unlike communicable diseases, the chronic progressive health problems of late life are, well, as I say, progressive, which means that prior to dying of such things, one is typically having to suffer a long period of declining and poor health and poor quality of life. So the amount of suffering that is generated by aging is also by far the largest amount of any phenomenon that we see in the world today, which means that it is completely unarguable to me that this is the world's number one problem. Now, on top of all that, we have the economic imperative, the fact that aging is so unbelievably expensive. I mean, it's not just the loss of all of this wisdom and knowledge that it happens every time somebody dies. It's also the fact that people are no longer in a position to be able-bodied and contribute wealth to society. And, their kids are less productive because they're having to look after their sick parents and so on and so forth. So the economic imperative is enormous. And, of course, the other thing we have to bear in mind is that this is not something that I've just got any kind of claim to originality for. This has been said by many of my colleagues over many, many years, pointing out that even a very modest postponement of these health problems of late life, maybe 7 years, which is the number that a bunch of my colleagues used in a very important initiative called the longevity dividend about a decade ago, 7 years would give the most, stupid numbers, trillions and trillions of dollars of savings.
Just mind-boggling.
Right. So you may ask, well, okay, why did this fall on deaf ears? It was basically directed at policymakers and opinion formers and so on. Unfortunately, the answer is extremely obvious. Namely, that the audience, while accepting the fact that even a modest increase in our healthy longevity would have these vast economic benefits, they did not accept that an investment into research in this area would actually deliver that progress, even that modest progress. They knew, same as everyone's known since the beginning of civilization, that this thing aging is somehow, immutable, and, natural and inevitable. And this, of course, is reinforced by this misconception about what aging is that I mentioned a moment ago, where people are thinking there's the diseases of aging and then there's aging itself. It's kind of, like age, it's just not going to work. And if they think that this investment is going to fail to deliver even a modest postponement of ill health, then, that rather changes the argument. It doesn't matter how big a number is. If you multiply it by 0, you still get 0, right? 0, the probability, right, of success. So it's fallen on deaf ears. Now, of course, now things are changing a little bit. In fact, maybe quite a lot, because more and more progress is being seen in the laboratory and even in the clinic, in clinical trials, with the very early, very incomplete and preliminary therapies against aging, and things that are actually being described as therapies against aging, like senolytics, which we can come to later. Seeing the actual results that are occurring. And perhaps this is going to change the argument and make the longevity dividend concept more effective in terms of actual changing of policy. But, I don't think we can rest on our laurels yet. We definitely have to carry on banging away and making this argument.
You're going to keep banging, I'm going to keep banging. First of all, again, really appreciate that. I want to make sure that especially the newer people to this type of aging discussion understand why I think it's important right now in this paradigm for aging to be recognized as a disease by the federal government and the government agencies of the world.
Let's just call it a medical problem.
Right, a medical problem. But I'm going to describe why I'm using the word disease. The FDA can only treat, cure, or prevent. They only regulate things that treat, cure, or prevent a disease.
That's not true.
It's not true.
No.
Okay.
The Food and Drug Administration, it's not called the Food and Disease Administration.
Right,
they can do
right.
what they like. And in fact, over the past year or two, there's been an enormous amount of progress in ensuring that the health problems of late life can indeed be approved by the FDA, as well as, of course, by organizations, by corresponding organizations around the world. Probably the single biggest thing that happened at the beginning of all of this a few years ago was the approval of something called the TAME trial. So TAME is an acronym, but it's basically a trial for metformin, well-known anti-diabetic drug, against aging. Now, you may ask, well, okay, how did the FDA do this? And it took a huge amount of discussion between the FDA and a number of senior gerontologists. Essentially what had to happen was that the definition of aging had to be cast in a form that the FDA could work with. Now, the FDA obviously already had a whole bunch of indications that it already works with that are age-related, Alzheimer's disease, things like that. So the challenge was for the organization to come up with something that would encapsulate the concept of aging in a faithful way while still being within the kind of language that the FDA understands. And they came up with something that was really quite elaborate, but what it did was it incorporated, of course, the multifactorial nature of aging, the fact that there are so many things that go wrong with people late in life, but it also incorporated in a very clever way the kind of crosstalk that exists between these things. So that we now have a clinical trial that's been approved. It's not started yet. In fact, it's not even been properly funded yet, but it's been approved by the FDA, and it is really a trial for a drug against aging. Now, there are a few obstacles still. First of all, this particular trial may very well never happen at all, and even if it does, it's probably not going to have much it's not going to be particularly overwhelming in terms of its results, because the drug that it is going to test is a very well-known drug that's been used by a very large number of people for a large number of years.
Metformin, right?
That's right.
Yeah.
And so, if it had a significant, a dramatic effect on aging, we would kind of know about it right now. In fact, one of the motivations for the trial was the analysis of past data, which seemed to show that it did have a non-trivial effect, but we shall see. However, the other big impediment to even getting this trial to happen is that because it's been around for so long, of course it's been off patent since before we were born, and so nobody's going to make any money out of it. But all of that doesn't matter. What matters is the definition of the endpoint for the trial. Namely this, as I say, this very combinatorial thing that encapsulates the concept of aging in all but name. Because that can be just copied and pasted into any other trial that may happen in the future, which may be for a therapy that is patentable and, of course, has just been developed. So all of this changes very substantially the incentive structure around Big Pharma putting serious money into the development of such drugs. Another thing that's happened much more recently, which is not the FDA, but it's also very important in a similar manner, is something that happened at the World Health Organization. So they have this thing called the ICD codes, the International Catalogue of Disease, and there they are using the word disease, but don't worry.
We're good.
Because actually, what happened there was they also were able to incorporate aging in an explicit way. And the way they did it was actually very correct, biologically correct. What they did was they didn't introduce a code called aging. Because if they had done, then you would have ended up with having to choose aging as an alternative to Alzheimer's or atherosclerosis or something like that, which is not biologically faithful in the first place. What they did instead was they introduced aging as what they call an extension code, which is a kind of qualifier that can be applied to other bona fide codes. And they called it aging-related or age-related rather than aging per se. So now we have a rather splendid situation where if you've got a bunch of drugs that have been approved for atherosclerosis, okay, but one of those drugs, just one, has been approved for atherosclerosis with this code, okay, then if a physician somewhere is treating somebody for atherosclerosis and that person is over 65, then the physician is pretty much mandated to prescribe that drug that's been approved with the qualifier rather than one that hasn't. So that's, again, changing the incentive structure a lot.
That's phenomenal. I've kind of heard you tell both of those stories in some of the more recent interviews that I've watched of you. Mm-hmm. And so basically what it sounds like is that there are actual people within these regulatory agencies who are now understanding that aging is more of, we'll just call it the problem, what's causing a lot of these problems.
Well,
is that fair to say? Or?
The only thing that's unfair about it is it makes it sound as though until recently these people didn't understand that.
Well, if they didn't, why weren't they?
That's not really true.
Okay.
The reason they were not doing anything was not because they didn't understand, but because they weren't in control. At the end of the day, the FDA is an instrument of the government. It has to do what the government basically says. So it was more a case of Congress not understanding, and other people who are fundamentally thinking about getting re-elected more than anything else.
Okay, that's great. And I've heard you say
I've
this.
got another example of that, which I might mention actually. So there's something called the Geroscience Interest Group. You know what that is?
I didn't hear.
Geroscience Interest Group.
I don't think I've heard of that.
Okay,
one.
so that's a kind of initiative that is going on inside the NIH, the National Institutes of Health. And it was begun by a guy named Felipe Sierra, who runs the Division of Aging Biology, as it's called, within the National Institute on Aging. So this, as you know, the NIH is this collection of institutes, about 30 of them. The NIA is one of those. The NIA does a bunch of stuff in addition to working on aging. In fact, the bulk of its money goes specifically to Alzheimer's research. But it also does, social gerontology, improving the dignity of the elderly, things like that. Only a small minority of the money actually goes to biology, and this guy runs that part. Now, what he did was, he said, well, okay, there's a problem with the funding structure of the NIH with regard to aging, namely that it is too balkanized, that the other institutes around the NIH, which are working on the so-called diseases of old age, like atherosclerosis or cancer, they fund those things as if they were diseases, as if they were separate from aging, whereas in fact we all know that there's a huge amount of connection between these things. Therefore, what we need is more cross-institute requests for applications, initiatives for funding. And so he started this thing called the Geroscience Interest Group, which was a way of getting a conversation about that going and trying to make things happen. And in fact, his boss's boss, in other words, the person 2 levels up who actually runs the whole NIH, Francis Collins, was very vocal in his support of this, not surprisingly, because Francis's own work is actually in an aspect of premature aging. So that sounds great, doesn't it? But it's basically got pretty much exactly nowhere in the several years now since that it's been going. It's basically just stayed as an interest group, literally, basically a talking shop, and very little money has actually been allocated in the manner that was envisaged. You may ask why, and of course the answer again is politics. The current situation is that there's a certain amount of money at the NIH and it has to be divvied up somehow or other, and any money that might go to these new requests for application has to come out of somewhere. And of course that means that there are going to be people who are opposed to it, whose vested interests are in favour of the status quo. And so, therefore, realistically, the only way that anything could actually happen in this direction is if additional money were granted to the NIH overall, specifically for this purpose. And of course, that requires the approval of, people who are elected. So, the fundamental problem is that the general public still needs a huge amount of education with regard to understanding why this is so valuable and so important.
And first of all, again, you piece together so many things there. It's incredible. I appreciate it. I've heard you say a number of those things in other interviews I've watched. So to me, to kind of summarize that to maybe some lay people and to also make sure that I heard that properly, one of the big problems, not just with aging, but in getting things done in general in our modern day global society with the democracies that we have set up, the way our countries and governments are structured, is that the political leaders aren't really leaders, they're more followers. They are just following public opinion so they can get elected, because the whole game is getting elected and then getting re-elected.
Yeah, and I mean, it's not as if I'm not in favour of democracy. I think I agree with what Churchill said a long time ago, someone who went to the same school as me. He said, democracy is the worst system of government ever invented except for all the others.
Right, and it's... my wife's laughing. I've heard that one a few times. We can get into volunteerism and some other things I want to discuss in a bit. But before we move away, I didn't want to put words in your mouth. I've just heard you say that a few times, and I want people to really understand that that is why you are so passionate and why you do interviews like this and why you're always going out doing lectures and traveling and devoting your life to this, because the way this is going to change the fastest and we're going to reverse the biological problems of aging is by getting funded from governments. They're the ones that have the most money.
Well, yes and no.
Okay.
So,
or is by swaying public opinion.
I've always felt that, in fact, way back 20 years ago when I started talking about this kind of thing, I would talk about what I call the triangular logjam of, governments essentially only do what the public approves of because that's how they get votes. And at the end of the day, scientists need government money. And then scientists, therefore, have to change public opinion. But unfortunately, in order to do that, they would have to say things that might appear to government to be irresponsible. So there's this inherent stasis in the system. But of course, that was first of all why I created an independent foundation that allowed a small number of people to vote with their checkbook rather than
the Methuselah
Well,
Foundation?
of course, initially the Methuselah Foundation,
okay,
but then SENS. That's right. And that certainly has worked up to a point. But now, with the private sector coming in, we again have a situation in which a small number of visionaries can make a huge amount of difference. And it took this long to get there simply because a large majority of those visionary people don't like giving money away. And we wouldn't have got this far if it hadn't been for the fact that a very small number of those visionaries do understand that there are some times when you've just got to give money away.
Peter Thiel.
Peter Thiel was our first major donor.
Right.
Yeah.
Has he donated more than that? Are you at liberty to say?
His total amount of donations is about 6 or 7 million, something like that.
Okay.
But he's no longer donating to us. Now he understands that he's basically done his bit. So his people periodically look at investment opportunities and get involved in potential companies in this space. But really, it has, from his point of view, become predominantly a private sector thing. And I do want to actually mention the extent to which I agree and disagree with that, because of course you're sitting here because the foundation still exists. So a natural question might be, well, why does the foundation still exist? Why haven't we just kind of shut up shop and declared victory because of the emergence of the private sector involvement, which is pumping so much more money in? The answer is because the private sector is pumping money in on a case-by-case basis. There are some areas of damage repair that are a lot easier than others, and the ones that are most difficult are still not at the level of sufficient proof of concept that even visionary people who are comfortable with high risk, high reward are able to see a proper value proposition. And therefore we are probably still, of course I don't really know how far we are away from that point where we really could kind of declare victory. So one actual thing to come back to in relation to that is crypto, because as you of course know, 18 months or so ago there was this enormous spike in the value of cryptocurrencies, and the result is that a number of people became much wealthier than they were expecting overnight, more or less. And that worked out rather well for us because we do have a great deal of support in the blockchain community generally. And so we received 4 7-digit donations in the space of about 3 weeks.
Yes, phenomenal.
Yeah, and these were, people who had been following our work for a long time, and who, felt that now was the time when they could actually give back. Now, most of those people were basically just giving away most of their newfound net worth all in one go. But the biggest donor of all was the guy who created Ethereum, Vitalik Buterin, who has, as far as I know, thus far not chosen to get involved on the private side as an investor. Rather, he understands and recognizes that there is still very much a job to be done within the philanthropic sector, and so he basically just gave us a bunch of money, and he continues to do so. And that's, to my mind, I wish more people were thinking that way. One of the really big pieces of good news, though, is that this is really young people. Most of the donors, in fact all 4, I think, of the donors that we got such a lot from back then were in their 20s. And these are people who had come across my work, when they were teenagers. Vitalik read my book when he was 14.
It's incredible.
And I think this is going to happen more and more. I actually wrote an editorial about it in my journal. I call them the children of the revolution. Basically what I mean is, these are people who have never had to change their minds about aging. I grew up knowing that aging was obviously the world's most important problem, and not knowing that anybody else thought differently. But most people didn't grow up that way. And so in order to get those people on board, one has to actually go and get them to revisit a fundamental precept that they have believed for a very long time. And obviously that's very difficult. Whereas if someone's grown up since they were a kid, knowing perfectly well what I've known since I was a kid, then you don't have that problem anymore.
Very well stated. Vitalik Buterin is the founder of Ethereum. I believe he donated $2.4 million of Ether back in, December of 2017?
That's exactly right, yeah.
And you said that he has donated some more SENS.
Sure, yeah. 6 months ago, last Christmas, he donated, so in Ether terms, he donated more than half as much 6 months ago as what he did 18 months ago. In dollar terms, of course, it wasn't nearly half as much, but but I'm sure he's going to keep it up.
For those that don't know, crypto had a huge bear market in 2018, so all the major cryptocurrencies went down dramatically, about somewhere around 80%. So it was tough, but I'm glad he did that. Are there any other major investors that you can share publicly?
Oh, sure, certainly. Yep, absolutely. So, and you've used the word investor again when I think you probably meant donor, but that's actually okay.
Thank you for.
But that's actually okay because there's a lot of overlap. So one of our most important supporters is a guy named Michael Grieve, who is from Germany, and who made his fortune in the early days of the German internet. He created web.de and a couple of the other major German websites. And so in 2015, he appeared on our radar in a very minor kind of way. He donated, I think, 20K to a end-of-year campaign. And then in the middle of 2016, he wrote to us and said, hello, I've decided to give you $1 million a year for the next 5 years, guaranteed. And he said, I'm also going to invest in startups that are emerging. And I'm going to invest about the same amount. In the end, what's happened is he's given us the $1 million a year, and he's also, perhaps a little more actually, and he's also invested, I think, quite a lot more than $1 million a year, and probably more like 2 or 3 in startups. And so, very much an overlap there. He very much recognises the same thing that Peter Thiel recognised a decade earlier in terms of the importance of supporting both sides of this. And a number of our other major investors...
Sorry, before you go to them, does that have anything to do with Undoing Aging being in Berlin, Germany?
It does, yes. Yeah. Undoing Aging is a conference series that we're running every spring, and we're doing it in Berlin every year, largely because it is being bankrolled by Michael. He's actually based in Karlsruhe, which is a little town elsewhere in Germany, but Berlin is the right place if you're going to do it in Germany. And it's been extraordinarily successful. It's pretty hardcore science meeting, so we obviously are populating the speakers purely with scientists, though of course people know how to speak to general audiences, so a lot of amateurs come along as well as delegates. It's very much a kind of a reboot of the conference series that I ran in Cambridge back in England, where before I moved over here. That was in the last decade, and so it's enormously gratifying for me to be able to do that again. But yes, that's also bankrolled by Michael. Other investors, like I say, yes, are doing the same thing. So Jim Mellon, for example, he's a British investor, made a lot of money in a variety of different sectors over the years, and he's very much decided that aging is the next big thing, so he's got into this. He's created an enormously important new company called Juvenescence, that's putting already getting on probably over $100 million, and it's going up all the time, into important new startups in this space. And he's also donating to us. Now, in his case, it's not at parity by any means. The amount he's donating is considerably less than the amount that Juvenescence is investing, but it's still a great deal better than nothing. And the more people do that, the better.
Definitely. And as you're saying a lot of these things, I follow you on different social media outlets and SENS, so I want to get the official social medias from you. We're going to link them in the description below, but so SENS recently started an Instagram platform a few months ago before this year's Undoing Aging, right? And then you're not on Instagram, right? There's an account on there.
To be honest, I don't have a clue what I'm on.
Okay.
I still live in the 20th century when it comes to the internet.
You have an Instagram profile? profile, and it's your face, and you have a lot of followers, but no, you have one post, and it's a picture of you. So I don't know if that's you or not.
It's my people.
Okay.
You know? I mean, and that's the same for Twitter and Facebook and LinkedIn and everything. I don't do them myself, to speak
Gotcha.
of. You know, we use them as ways to communicate the foundation's message, and I stick to email.
Got it. Okay, so just to make sure that I have all that correct, your LinkedIn, your Twitter, and SENS definitely has an Instagram. I'll link those in the description below. Those are the ones that I follow you on.
Sure, yes. And of course, the main thing is to link to our own website.
Right.
Yeah.
I'll definitely have the SENS website in there. And then also, congratulations. This is the 2-year, anniversary of your new role at AgeX, where you're the VP of New Technologies, right?
New Technology Discovery, that's right.
New Technology Discovery. And can you share just a little bit? It's a part-time role. Obviously, you're super busy with your full-time job, and then taking time out to do interviews like this and travel the world and do all sorts of things. Can you just talk briefly a little bit about what that role entails and how it's evolved in the last 2 years?
Well, actually, the role is pretty minor, really. You know, my goal there, why Mike hired me is really, first of all, to just have, do what I tend to do as a scientist, which is essentially nothing to do with what goes on at the bench, but rather just kind of pacing up and down and talking to myself and coming up with new ideas for the future. Which is, of course, only a minor aspect of what any company actually does. The company is mainly focused on things that are quite close to being a product. So actually what I'd rather prefer to talk about is what we're doing at AgeX in terms of product, because this is because this comes back to what I mentioned earlier about how the foundation really doesn't do very much stem cell work. AgeX is very much doing stem cell work. And indeed, back when I created SENS, or even Methuselah, Mike West, the guy who runs AgeX, was already very much doing that at Advanced Cell Technology, and before that at Geron, and was making enormously important contributions to stem cell research that was going to be useful against aging. Now what we have at AgeX is 2 major themes, both of which are likely to really be transformative in terms of applying stem cells to problems of aging. The first one is something they call pure stem, which is really just a way of making particular types of stem cell at much higher purity than before. The standard way of making a particular type of stem cell is you start out from what's called a pluripotent stem cell of some kind, which is essentially a stem cell that hasn't been told what kind of stem cell to be. And you then nudge it in particular ways with particular chemicals or whatever that have been identified over the years in a particular direction. And the result is you end up with a population of cells which is mostly the kind of stem cell that you want, but only mostly. There's going to be lots of other cells in there, cells that are still undifferentiated and pluripotent, cells that have become different kinds of stem cell, and all in all, you don't really know what's going to happen if you inject something from that into the body. So it's a big problem. And at Advanced Cell Technology, Mike's previous company, they developed a really cool way to get around that problem. That now, with the result is they've now got a couple of 100 different types of particular stem cell that can be used for all manner of different things, and there are a couple of those that are going forward as the kind of lead products into clinical trials. The other thing that we are working on is something called ITR, Induced Tissue Regeneration. And this is all about essentially making cells that are already in the body behave in a more stem-like way than they normally would. This is something that again, quite a lot of other people have worked on in a different way. And again, we believe that our approach to doing it has the potential to be much safer and therefore much more effective than anything that other people are doing. But that's at a considerably earlier stage of development, so I don't really have much more to say about that.
Okay. That's really helpful. And how this, I guess, ties in, if you're watching any other of my previous interviews, I just interviewed Bill Andrews about 6 weeks ago, and he led the team at Geron that Mike, you mentioned, co-founded. Bill led the team that discovered the telomerase enzyme around the mid-90s or so. So before we move away from the donors, investors conversation, let's try and finish that up. I had a question on, Jeff Bezos, $100 million donated to longevity. What's the name of the company he donated?
Human Longevity Inc.
Human Longevity Inc. Yes. Why did he not donate that $100 million to SENS?
Well,
what's going on
that's
here?
an even more apposite question than you may know,
Okay.
because way back in 2006, I spoke at TED. I'm sure you know that.
Yes.
And I indeed, because Chris Anderson, the guy who runs TED, became quite a fan. He was kind enough to let me come to TED for the next few years at a very, very, very cut rate. So I was at TED for maybe 5 years in succession. And Bezos goes to TED every year, of course. Even back then he was doing so. He was perfectly wealthy enough already.
He's spoken there as well, yeah.
Well, yes, but the point is he goes there, and he actually takes his entire family. It's quite an entourage. But the point is, he actually would take the trouble every year to actually, on his own initiative, come up to me and ask me how things were going and so on. And he even had me along to a little kind of retreat that he organised in Santa Fe at some point during that period. But he's never given us a penny. So, you have to ask why, absolutely. Now, of course, the thing about donation is when people give you money, they're perfectly happy to tell you why they gave you the money. When people don't give you money, it's like getting water out of a stone to establish why they didn't
What's
give you the money.
going on, Jeff? Come on.
So, of course, there may be many reasons, but typically it's reasons that they are in some sense ashamed of. Maybe their wife told them not to, or maybe they
He's divorced now,
don't like people with beards, or they don't like charity in general, things like that. It can be anything. And I have no idea. But you're quite right, he did invest in Human Longevity Inc. And in general, I would say that maybe he just doesn't really like high risk, high reward things. He likes to invest a little later. So Human Longevity is very much a normal company,
Yeah.
Perhaps an even bigger paradox is Larry and Sergey, the Google twins.
And the other Larry Ellison.
Well, okay, Larry Ellison is not such a paradox. What happened with Larry Ellison was that he started to get into this whole thing purely charitably, created a non-profit. Exactly why he created it, there are rumours about
very secretive,
doing a little bit of a deal with the IRS because of something else he'd done before. But
and this was way back in the 90s, right?
This is it. It was in the late 90s. That was before I existed, to speak of. And, it could have been a really big deal. But unfortunately, he started out by making one utterly catastrophic strategic error, which was whom to hire to run the thing. His goal, and indeed the stated goal of the Ellison Medical Foundation, was to complement what was being funded already in this space by the National Institute of Health. And what did he do? He hired to run the thing the outgoing head of the Division of Aging Biology at the NIA. If you could think of one way to minimize the chances that your foundation would actually complement what the government is funding already, and to maximize the chance that it will in fact just supplement then that's what you would do. So, of course, the result was that the Ellison Medical Foundation achieved pretty much exactly nothing.
I've been to the website many times over many years. I'll check in every couple of years. I'm like, what the heck are they doing?
They spent $500 million over a period of 15 years.
So it's not that wealthy people like Larry Ellison. So just so people know, Larry Ellison is around like the 6th wealthiest person on the planet, founder of Oracle, somewhere around $60-70 billion. Jeff Bezos, I'm sure probably everybody knows, founder of Amazon, wealthiest person on the planet, over 100 billion. So, it's not that these people aren't paying attention. It's not that you haven't met them, networked. It's that...
Well, I haven't met Larry Ellison.
Okay, sorry.
So Larry Ellison made this mistake before I was around to stop him.
But he's still clear.
But the point
he's still very interested.
Well, the other thing is, if you're that kind of person, you've probably got a bit of an ego. And, so if you've made, however bad the mistake is that you've made, however bad you realise it is, actually, changing course is not something that comes easily to these people.
But he's still suffering from the same problem we all are,
which
is aging.
But also, he's coped with that in the same way that people tend to cope with situations like that. In other words, he's made his peace with it and just decided to believe the rhetoric that says that this is simply too hard a problem to solve in his lifetime.
Now, I personally I believe Larry Ellison right now is about 73 years old. I've seen some recent videos of him. I think he looks pretty good for 73, personally. That's my opinion. So he's clearly doing something. We can get into what you're doing in a bit. I know you've talked about this in different interviews, but do you have any idea what you think he's doing? Or
Of course not. I have no idea at all.
Okay, speculation.
However, the thing is, he doesn't. He closed the foundation down very abruptly in 2014, and he never actually explicitly said why. But the most popular theory is that he did it in response to the creation of Calico. He felt, okay, it's not going to make much difference anymore. I'll let the Google twins do it. Unfortunately, Calico is even more of a catastrophe.
Yeah.
Because first of all, it's even more money than what Ellison put in, and secondly,
do you know about how much Calico is? Is it speculation?
Let me put it this way.
Okay.
The rumor is that when Art Levinson, the previous leader of Genentech, who was headhunted by Larry and Sergey to run Calico, when he said, "What's my budget?" Larry said, "We'll tell you when we run out of money." I don't think there is a meaningful concept of what the budget actually is.
These are the co-founders of Google, just so everybody follows. And Calico is a spin-off of Google from, I believe, late 2012 was when it was announced.
2014, I think, yeah.
2014.
So the thing is then, what is Calico doing? Well, of course, the thing is Calico has been set up as a company, and they don't need any money. So, they don't need any money from outside. So, naturally, they don't say much about what they're doing. Right, because they want to kind of eventually make money back, maybe, So that's life. But of course, we can tell a fair amount about what they're doing, not just from informal conversations with people, but also just from whom they hire. Right, and the best way to put it is they have created an entire vast valley of death internally. So, of course, the valley of death, I'm using the term from the venture world, that a company may start out with great ideas, great concepts, and it may eventually have a vision of how it can turn a proof of concept into a product. But between the two, you've got to get from the concept to the proof of concept, which is the early stage technological development. And that's when a lot of startups go south. Right, because they can't convince investors that they're going to be able to do that. Now, Calico, as far as we can tell, is precisely that in this space. They've got this at the beginning, this paradise of research where they've hired fantastically good researchers in large numbers, paid large salaries to find stuff out. To increase our understanding of what aging is, to create knowledge. And then at the other end, they've got Genentech Mark II. They've got these people who know all about how to turn a proof of concept into a product. Fantastic. And they've got zero in the middle. They've got nothing that turns knowledge into proof of concept. I don't think they even have anyone whose title is Chief Technology Officer. And here's the problem. Larry and Sergey don't have the excuse that Larry Ellison had of having done it too early and not met me and so on. They met me in the early 2000s when they still had enough time to keep up to speed with visionary technology of various types. They've been perfectly well aware of what we've been doing all this time. They too have never given us a penny. Now again, you can argue, well, maybe they just don't like charity. In fact, Larry has said this publicly, that he just thinks charities are inefficient, which is a stupid thing to think, but still, you can't legislate for that. But the fact is, even though they've created something, they've done it in the most crazily stupid way. So they're just throwing money down the drain at vast rates, and it will be pure serendipity if Calico ever actually contributes anything meaningful to the defeat of aging.
Well said. Just a quick story on my end. So I used to work at LinkedIn. That was my last job. I sold the e-learning part of LinkedIn. We were acquired by Lynda. That was one of the acquisitions I went through. And I was in sales, and Calico was one of my accounts. And so I went to Calico's headquarters, which is in South San Francisco, 30 miles or so north of here. And I met with all of their HR team. And so, all the information I had at LinkedIn, I was looking at all the decision makers. And I think you're right. I don't think they had a CTO. And just from trying to learn as much information as I could by meeting with them and going into their office, I came up with almost nothing. And they didn't want to talk about anything.
Well,
and researching online, it's just, I can't find anything.
So, of course, I knew about Calico from the very, very beginning. In fact, when it was announced as an exclusive in Time magazine, Time got me to write the reaction piece, and I was extremely effusive because I was very hopeful back then. It took me, I actually got to meet Art Levinson personally for the first time just very shortly after that, when everything was just at the very embryonic stage, and we got on really well. It was surprising to me that it then took me quite a while, like another 6 months, to actually coerce Art into letting me and a few colleagues from here come along and present to Calico. But when we did, Calico was still literally half a dozen people. Unfortunately, this template had already been set in stone. Art had made the decision to hire as his chief science officer an old friend of his who was an emeritus professor from Princeton, a fantastic scientist, no question, named David Botstein, who doesn't have a translational bone in his body. In fact, he is on record as saying he doesn't, and who believes that the amount that we know about aging is a negligible proportion of what we need to know to actually be able to do anything about aging, and therefore his goal is to find out more. And he just is completely unable to see that we might know enough already to be able to make a significant difference. And he didn't even have the courtesy to turn up to the meeting that we had at Calico. So it was a complete waste of time.
My goodness. Well, it's unfortunate, and that's why I'm here right now personally, and I think the SENS is doing incredible work, and it is frustrating, but as I've gotten a little bit older, I think I mentioned earlier I'm 34, you're older than I am, these kind of frustrating things that happen in life, you either get angry and then move past that stage and learn from it, and then next time you see that pattern happen again, you recognize it so you don't waste your time, or you can change others, and hopefully that's the only positive we can take from this, and that hopefully
yes and no.
they'll
Plus
change.
I have the advantage that I can mouth off about Calico on camera,
right.
and perhaps eventually it will actually sink in.
Yeah, no, I agree, and that's why we're talking about it and doing this here. So let's pivot, if it's okay. Sure. I've heard this asked you many times over the years, but I'm going to ask you again. What do you personally do in July of 2019? If you can give us your Aubrey de Grey, what do you try and do to stay young and healthy? And you can give all the disclaimers you want. You're not a nutritionist and blah blah blah. But what do you think is most important?
Okay, so first of all, the question "what do I do" is very different from the question "what do I recommend that other people do."
Please answer them both. Correct. Right. You're correct. Wife's laughing here.
Right. Yeah. So what do I do is basically nothing. I am fortunate enough to be a very well-built guy, and I've also been fortunate enough to have that proven. It's not just my subjective impression, but over the years, starting I'm going to say in 2002, I've had on I think 6 separate occasions very, very comprehensive high-end tests of my biological age.
I'll again plug the Immortalists documentary.
Yeah, one of them was on
that
there
very well with Dr. Terry Grossman's
That's right.
office.
They measure like 150 different things in your blood, and they do a whole manner of physiological and cognitive tests and so on. So it's all very thorough. And I always come out ridiculously young, like well over a decade younger than I actually am.
I'm going to cut you off real quick. I'm looking at your hand. What are you 54?
56.
56. Like no age spots. Your hands, if I were to just look at somebody's hands like that, 56 would not be a number I would say. I'd probably say like 30s.
Very good.
So sorry, go ahead.
Yeah, so I'm doing well. And of course that means that I have to be quite conservative about any experimentation I might do to alter what I do in terms of diet and
you already got going.
Yeah, it's kind of if it ain't broke, don't fix it. Now, the fact is, I don't do anything to speak of. I've always, I can eat and drink just what I like, and nothing ever seems to happen. I don't put on weight or anything. I don't even need to do any exercise to speak of, other than hauling my ass through airports. I'm just a really lucky guy that way. And in fact, it's fair to say that there's one thing I do which is bad for me, unequivocally bad for me, which is I don't get nearly enough sleep because I'm traveling so much all the time.
How much sleep do you think you get on an average night?
Well, it's hard to know. I mean, also it depends what you mean by the night, because I'm sleeping on planes so much.
Right.
And,
okay, well then let's ask a more objective question, or somewhat subjective. How much do you think you travel, or have been traveling in the last 15 years?
I probably only spend about half my time on the ground.
Okay.
Well,
that is
I spend half an hour at home anyway.
quick little bit about my wife and I. After we quit our jobs, we sold our home here in the Bay Area, and we just wanted to travel. So we went to 25 countries last year. So I know how taxing that is, and not just from a standpoint of the physical grind of traveling, the hotels, the jet lag, but actually like, all right, now we got to book another hotel. Well, let's get on hotels.com and make sure we don't stay in a rat's nest, you know, and it's a lot of stress, and it takes you away from other things you want to be doing.
Yes, that's true. I mean, for me, it's not so stressful because, first of all, you know, other people book my hotels for me.
That's nice.
But also, you know, I know that I'm doing it for the thing that I have chosen to dedicate my life to.
Right.
And I get a huge amount of positive feedback. You know, I want to say this actually because it's quite important. You know, you've been very complimentary about how committed I am and everything like that, and it's certainly true. But I do get, you know, people coming up to me in the street all the time, you know, congratulating me on what I'm doing and saying how much of the support they have and all that kind of thing. You know, so the people I really look up to are the foot soldiers. You know, the other people, the many other people in this movement who are every bit as committed as me. They work every bit as hard and so on, and they don't get any of that. They don't get any of the adulation. So, you know, it takes a lot of people to make this happen, and I'm just the figurehead in some ways.
Yeah, that's a really great point. It leads me to another question I want to ask, but we still need to answer the other one. So so I don't forget. The other question is, I want you to kind of tell me, who else should I be interviewing? And just so you know, I live here in California,
wait a minute,
so I can drive.
I haven't done the business of what I recommend.
Right.
People
Let's
should
get
do
to
in
that
terms
first.
of lifestyle and diet. Yeah, because you know, people ask me this all the time. You know, and unfortunately, the thing is, there is no good answer to that question, simply because people differ too much. You know, people's metabolism has an enormous amount of variability from one person to another, and so sometimes a particular diet, you know, a low carb diet or whatever, might be good for you, and sometimes a low fat diet might be good for you, and you know, and so and different. I mean, of course, there are plenty of obvious. Well, there are a few obvious things that you shouldn't do that would shorten your life considerably, like, you know, smoking or getting seriously overweight, or, you know, having a very unbalanced diet that's short of micronutrients. But hey, you didn't need me to tell you any of that. You know, it's just do what your mother told you to. And beyond that, the thing is, the incremental advance that one can get over and above just doing what your mother told you to is tiny, even if you do everything that's just right for you. It's very, very small. We can see this just by looking worldwide. We see that, you know, people laugh at the USA a lot for their life expectancy because you're down around, I don't know, 50th or 40th on the league table of longevity, even though the actual expenditure on medical care per head, per person, is far more than it is in any other country. But it's a little unfair to be too, to take that too badly, because the fact is the absolute number in terms of the difference in longevity between the US and the country number one, namely Japan, is less than 5 years.
Right.
So, you know, it's not all that different, really. Anyway, so, but coming back to the point, what can one do? Well, as I say, it's possible, at least for most people, to get a little bit of advance, maybe, by doing the thing that's just right for you. But since different things are right for different people, the only generic advice that I can give is pay attention to your body. Do things that seem to work. And, of course, you know, don't believe anything you read in a book, because books by definition are written for everybody, and nothing applies to everybody, and you can't make much money by writing a book that just says pay attention to your body.
Interesting. So I think I asked you before when we got sidetracked, how much sleep do you think you get? Like, are we talking 4 hours?
Oh,
6?
No. I probably get 7 or so hours when I'm at home.
Okay.
Yeah, it's.
I'm going to say this right after you said that comment. I read the book Why We Sleep last year by Matthew Walker. He's a sleep scientist at UC Berkeley, and he's now Google's sleep scientist. I watched like tons of his podcast interviews like this last year, just went deep into it. So I know way too much about sleep, applied a lot of these things to my life. I also started doing intermittent fasting, and I didn't think I had about 20 pounds to lose, but I lost 20 pounds, and now I weigh about what I did when I was in high school. Nice. I just feel better, you know, forced me to go out and buy new clothes because I'm cheap, so I was like, oh, this is kind of a side effect of this as well too. But I just generally think that sleep is super important, and what he says is that from their research, below 7 hours a night consistently, or every single night, it's just really bad. You do it consistently, it's really bad. Except for a very small percentage of the population has a gene mutation where they can get by with it.
Yeah, I mean, again, you can't really generalize too much. I mean, I'm quite sure that a respectable proportion of the population is okay on 6 hours. But yeah, I mean, of course, you've got to find what you need.
And so I've heard you say this many times about yourself. I think maybe because you are so intelligent and well-versed in health and longevity, maybe you're being a little bit modest because, I mean, you look great. And I think that one thing that's really important that's not well understood by most people, and even people who slightly understand this don't appreciate it enough, you are doing what you want to be doing almost every single hour. And so I think that just mental, physical, emotional stress is really poor. We've already is really poor for your health. We've already talked about the physical stress, the airplanes, but you're passionate about what you're doing, and so I think that that's really important in contributing to, you know, your health.
You're 100% right. The only job in the world that I would take in preference to the job I've got is Chief Technology Officer at Calico.
Okay, yeah.
Yeah, I mean, it's an enormous privilege to have been able to rise to the pinnacle of my chosen field of endeavor and to make such a difference in the way that I have always wanted to make a difference. And it has an enormous impact on my psychological well-being. I'm quite sure it does, relative to the situation of people who just are frustrated by their everyday lives.
And so, appreciate you saying that. We seem to agree on that. I'll just do this real quick to the camera. If you're doing something that you don't want to be doing in life, if life's terrible, just develop a plan. Comment below, reach out to me. I'll give my best advice real quick. But just life is too short. I mean, it is the longest thing you'll ever do, but it's also short. You're trying to make it longer. That's what we're doing. But it's not worth it, you know. Sometimes people are trapped and everybody's situation is different, but, you know, you got to be doing what you love to be doing every day, or you're just wasting your life.
And of course, you know, that is the underpinning of why I chose my first career.
Right, computer science. Okay, so really appreciate you talking about both of those things. So before we move away too much from what you're doing and what you think is important for health, you know, all of these exciting experiments and advancements, are you not at least tempted to undergo something? And
I am obviously keeping a close eye on everything that's coming along, both in terms of how efficacious it seems to be in the laboratory and then in the clinic, and also, of course, in terms of how safe it seems to be. But I'm always paying attention to how rapidly those parameters are improving over time. If I see that something looks safe and effective up to a point, but I also see that a year ago it was considerably less safe and effective, and I know the kind of research that's going on underlying that area, then I will be able to form an estimate of where it's going to be a year from now or 5 years from now. And if I believe that it's likely to be, you know, very considerably, even unrecognizably better then, and if I don't need it yet, then clearly the cost-benefit ratio adds up to waiting and seeing. Of course, this is ultimately all a result of the fact that the therapies that I believe are going to be most important are bona fide damage repair therapies, rejuvenation therapies, which therefore will be every bit as effective if I start to apply them when I'm in, 10 years older than I am now, as they would be if I'd started 10 years ago.
Okay. Great answer. So I mentioned this earlier. I don't remember. I think it was off camera right before we started. So I had some umbilical cord-derived mesenchymal stem cells or medicinal signaling cells injected into me back in December. I had to go down to Mexico because it's not legal to do what I did here. I feel it's helped tremendously. I've tried to be objective. I spent a lot of my own money on this, so I don't feel that I have any reason to not be objective about this.
Oh, that's a big reason.
Right, well,
it's called sunk costs.
Sunk costs, okay. Right. But I'm trying to, I understand that as well, but I'm trying to not fall into that mind trap, but I also understand it's difficult. Just real quick, I don't want to spend much time on this, but I basically had a 3rd-degree ankle sprain in my right ankle when I was 19 years old. And anybody who knows anything about ankle sprains is really bad. I had 1st and 2nd-degree ankle sprains many times when I was younger playing basketball. This one was different, black and blue, up to here. And just being 19, you're like, oh, this one's it's just worse, it's gonna heal up. Well, it never fully did. 14 years later, just chronic. So knowing the chronic pain that I went through, and then how it affected my knee, and then from playing too much baseball my whole life, and then dodgeball, I had shoulder problems. That's where I had the injections, and then 200 million of them IV, which of course go to my lungs and heart and don't really affect that. They dramatically got better around 2.5 to 3 months. So could it be placebo, subjective? It's possible. It just seems to me highly unlikely.
I mean, there's certainly plenty of good reports of stem cells being very beneficial in a variety of different ways. Of course, the concern that people always have is that you don't hear about the people who had negative effects.
Right.
Or indeed who had effects that were positive for a short while, but then essentially no follow-up.
I've had a little bit of dip-off, just to be clear on that.
So I mean, I think the ideal situation would be if these therapies were being provided not only legally, but also by entities that were invested in doing really good follow-up and reporting of both positive and negative outcomes, so that a much more objective and comprehensive assessment of these therapies could be compiled a lot sooner than would happen by the more traditional medical, placebo-controlled medical trial procedures that are normally used.
Okay. I agree with that. But before we move away from stem cells, there's one company in Kiev, Ukraine called EmCell. The director of a documentary about this called The God Cells, his name is Eric Marola. He's agreed to an interview with me, so I hope to interview him to get more details from him about this. They seem to be having phenomenal results. They're the only company using true fetal stem cells. They're getting them from 7 to 12 week abortions. So regardless what you think about abortions, they're already done. They're just taking them from already done abortions that's where they get their stem cells from. So I think that getting back to politics and public opinion, PR and stuff, the abortion topic is obviously just so controversial everywhere. I don't feel like people are researching it enough as it should. It seems to me that is getting the best results, their clinic. Have you looked into that?
No, I don't know their results, but of course everyone would claim that they're getting the best results.
Right, yes.
I mean, the main thing we have to bear in mind here is that the origin of the stem cells that are injected shouldn't matter, because the knowledge that we have these days about how to manipulate stem cells in the laboratory between isolating them and injecting them is, very much greater than it was even 5 years ago. And the better we get at those kinds of manipulations, the more straightforward it's going to be to identify and isolate and inject the best kind of stem cell for a particular condition. Of course, this is still a very, very early stage research area. Huge amounts are still not known about even how stem cells exert their effects. One thing that has only really been appreciated for less than 10 years is that most of the benefits that appear to be derived from stem cell injections are not from the stem cells going in and replacing cells that the body wouldn't have replaced on its own, but rather from the stem cells actually secreting stuff that makes their environment more useful and more regenerative. And then indeed those stem cells that one injected may actually be rather short-lived. They may actually be destroyed by the host immune system rather quickly, but they will already have had a beneficial effect in the meantime.
Yeah, everything you said there from my research on stem cells is completely accurate. And just to piggyback on that, what you were referring to, that's why I referred to them as medicinal signaling cells. Mm-hmm. The person who discovered and named MSCs is Arnold Kaplan in the late 80s, and he named them mesenchymal or mesenchymal. Mm-hmm. But for the last decade or so, he's been on a crusade to rename them medicinal signaling cells, which hasn't worked out very well because of branding. Once something's named, it's hard to switch it.
Yes, right.
But he's done that for exactly the reason you mentioned. They found that the exosomes, the cytokines, the trophic factors, those are the things that are signaling the other cells to behave. I like to phrase it as it's kind of like a manager coming into an office and say the MSCs are like get to work, do your job. And the cell's like, oh gosh, we can behave younger and do things that we weren't doing before.
There are exceptions, of course. So, for example, in Parkinson's disease, for sure, the actual problem is genuinely that cells die and they are not automatically replaced by cell division. In this one part of the brain called the substantia nigra. And so there, stem cell therapies are very promising, and indeed there's a bunch of clinical trials ongoing. But there it will genuinely be a case of long-term repopulation. The cells go in and they actually divide and replace the cells that the body was not replacing on its own.
Okay. And then, in general, just the term stem cells, it's such an overarching word. It's kind of like cancer, but the more you dive into it, you're like, there's so many different types of cancer. They all behave so many different types of ways. And I definitely will echo what you said, that we just seem to be in a very early stage in the stem cell research. So it's very exciting, and there's new things happening every day, but it's one of those things, the more you learn, the more you know how much you don't know.
Exactly.
So I think we're getting to the point where we have about a little over 20 minutes left. So maybe we could hop into the rapid fire right now, because there's going to be people who are going to be upset if we don't talk about certain things. So I want to try and at least cover those. So let's talk about different therapies that people are excited about right now. I'll start with one that I just mentioned. Exosomes. What do you think about exosomes in general?
So exosomes, of course, are not a therapy. They are a vehicle for supplying stuff. So exosomes can be isolated from the culture medium in the laboratory that is that has any kind of cell in it. And if you've got a particular type of stem cell, for example, a population in the laboratory, then you can just isolate exosomes that have been released by those cells. Then you can inject the exosomes into a person instead of injecting the stem cells. Now, that sounds like it would be a little bit of a poor man's way of doing stem cell therapy. It sounds like it would only supply much less of the right stuff, maybe. But you never know. It might actually be good enough. For example, we've certainly found, if we use another area that's been popular recently in research, namely parabiosis, where you connect the bloodstreams of a young animal and an old animal, and the old animal gets younger. We found, and indeed this was work that we funded at SENS in a lab at Berkeley, that you can just do a single one-shot replacement of maybe half of the plasma in a rat or a mouse, and pretty much the same things happen. Most of the same regenerative effects are seen, so you don't need continuous supply. Quite a surprising result, I would say. And so it may be, again, with exosomes, that just a one-shot like that, without any actual cells, will be effective.
Okay, thank you. Two things there. Number one, I reached out to Jesse Karmazin, who is the founder of Ambrosia. We had a few conversations back in 2017, communicated with him last year, and then I saw that it appears that they just kind of shut down from the FDA basically telling them to shut down back in, I don't know, March. I'm going off memory here.
Yeah, we have to be careful about this, because what Ambrosia did was not plasma exchange.
Right.
They just took young plasma and injected it without taking any of the old plasma out of people.
Right.
So in other words, they only, of course, if you're doing that, then you can only inject a very small amount. And whether that really had any effect, or would it even be expected to, is perhaps a little questionable. But you never know until you try.
I'll share what he just told me. Keep in mind, this is anecdotal. He said this is, he's fine that I could share this. This was, they had 80 patients at the time in late 2017. He said that they did 5 biomarker tests beforehand and afterhand. One of them was not telomeres because it was too expensive, and they were a private company working on a budget with not much funding. And he said that, from the people that went through the therapy, which was 18 to 25-year-old young plasma going into a minimum of 35 is where they had cut off as a youngest age. Most of the people were in their 50s and 60s and older. They all received reversal of these biomarkers from the test afterwards. So I just find that to be good and encouraging movement, and so it's just frustrating that it was shut down, and I don't know the details. And since Jesse hasn't replied to anything, I'm sure he's pretty shook up with what's happened. So Jesse, hope to get back in touch with you. Hope we can learn more on that. So,
sure.
But that's different from parabiosis, right?
Oh, yeah.
As far as classification, which is actually putting the animals together, like stitching them together. Regarding the exosomes, I interviewed Dr. Ed Park in March down in Orange County. He runs an anti-aging company called Recharge Biomedical, and he had just injected his mother with, I believe, I don't remember, I'm not going to say the exact number, a lot of exosomes. and she had really good results in a few days. This is anecdotal, subjective, just disclaimer here. So now he has injected himself, and he's blogging about it, and he's doing some YouTube videos educating people. And then I found a stem cell and exosomes group on Facebook where people have been getting exosomes injected. And again, subjective, anecdotal information, but people are doing this, and from what I've just personally looked into, they're having better results than even people who have done umbilical and autologous stem cells. Autologous derive from bone marrow and from their adipose fat. I've talked to a few people who have done autologous, adipose, got pretty good results from stem cells, then exosomes later because they had chronic diseases, and like you said, it keeps coming back. The exosomes were literally 8 times better. So just anecdotal. I'm excited about it, and that's why I asked about it.
Sure. I mean, I think one thing that one would want to point to as a reason why exosomes might be expected to be better, even though you're only doing a one shot, is because they will circulate better. If you inject stem cells into a particular location, the stem cells will pretty much stay where they are. I mean, of course, you can inject them into the blood, but then they go to particular places and then they'll stay where they are, whereas exosomes may be able to penetrate into tissue better.
Definitely. Okay, so then NAD+, that's a big one people are talking about. You have the pill Ellison that people are taking and paying for. And then you have the NAD patches and NAD infusions. What do you think about all this
and of
stuff?
course, there's also the NAD precursors, nicotinamide riboside and NMN. This is, again, early days. There's a huge amount really not known about how these things are metabolized and why they even matter. And another thing in terms of measuring is that if you measure the level of NAD in the blood, then you may not be seeing anything that's really representative of what's going on inside cells. Because there's complicated reasons why the compartmentalization may be different. But for sure, it seems that as people get older, the total NAD, the NAD plus to NADH, becomes more reduced. In other words, a higher amount of NADH, a lower amount of NAD plus. Now, the total amount actually also goes down, so it may be more a case of about the same amount of NADH and less NAD plus. But the ratio is probably what matters the most from a biochemical perspective. And reversing that, therefore, sounds like maybe it would be a good idea. And one can also see that this would be rather suggested by what happens in famine. I was mentioning famine earlier on.
Right.
When you are in a famine, obviously by definition you're not having so many calories. What are calories for? At the end of the day, what happens is that the nutrients are broken down and the electrons are removed from the nutrients and transferred to oxygen, and that is a process that extracts energy from the nutrients, which is used to make the body work. Now, those electrons get from one place to another via NAD. NAD is a kind of reservoir of electrons. So you've got to make sure that that the reservoir has how full the reservoir is about right. Otherwise, things slow down. And so this, it would kind of make sense that anything that rejuvenates the NADH NAD plus ratio is going to be in some form a calorie restriction mimic. And so it all makes biological sense, as well as, of course, people, as you say, reporting various good effects. But then the next question is always, okay, but which one should I take? Should I be doing patches, or should I be taking this precursor or that precursor? And honestly, at this point, there's no way to say. The reason why there are so many products out there is because there's reasonable justification for any of them.
That's a very good point, and that's probably not just true with NAD+. It's probably just general good advice for all of this stuff out there. I mean, it swings a little bit more from topic to topic. There's more data on certain things, but we're still in the general early stage in most of these therapies. We mentioned Liz Parrish's gene therapy before. Can you maybe just share what your beliefs are on gene therapy, and are you excited about it? If you had a list of top 5 things, would it be in it? To combat aging and damage.
So there's two different things here. You're asking about gene therapy in general, and you're also asking about specific genes that one might supply. So The fundamental difficulty at the moment is that the methods that we have for supplying genes to the body are extremely primitive. They are only capable of genetically modifying a very small proportion of the cells in the body, and they have, there are strong arguments to suggest that they are very dangerous, that they have a high risk of making the occasional cell cancerous. So this is largely why gene therapy has failed to make it out of clinical trials at any time over the past decades that it's been worked on. And actually one of our major projects is looking at exactly this, trying to develop a much better vector, as it's called, for gene therapy, because we recognize, and have for a long time, that a number of the damage repair therapies that we're trying to implement will, at the end of the day, need really good gene therapy in order to be applied to human beings. So that's one area. Gene therapy research is still very much going on. It's going to be very necessary, and we've got a long way to go. In terms of what we can do at the moment, of course, as I say, vectors do exist. It's just that there are a lot of questions about their safety and efficacy. However, then if you're going to do it at all, then the question is what genes to supply. So you mentioned Liz Parrish had chosen to look at these particular two genes, telomerase and follistatin. Telomerase, there are questions about whether it's pro-cancerous or not, and it's complicated because a reasonable prediction is that telomerase stimulation might improve one's cancer profile, actually make it less likely to get cancer in the short term, because it would probably improve the quality of the immune system, which of course is very important for attacking cancer, but it might have bad consequences in the longer term by taking cells that were precancerous and helping them over the edge into being genuinely cancerous. So we honestly don't know yet. However,
but now we have somebody who's done it, and now two people.
Well, again, even
10, 20 years, 30,
what you can get from occasional, one or two people is not very clear.
Right.
So then the question with follistatin is perhaps a little less controversial. It seems pretty clear that loss of muscle mass during aging is a severe problem that has widespread knock-on effects in terms of health all over the body, because the muscle is a big source of our homeostatic capacity, and therefore restoring muscle is definitely to be recommended in one way or another. The idea of follistatin is that it inhibits a protein that inhibits, biology is like that, it inhibits a protein called myostatin that inhibits the growth of muscle and the maintenance of muscle. So the result is that one would expect muscle to be restored. And the only difficulty, of course, is that Liz is pretty young. She's in her 40s and she's definitely in very good shape. So really determining whether her health is improving, even if maybe her muscle mass is increasing, is a little bit hard to say.
Okay. So you're basically, it's fair to say, you're not convinced yet from almost 4 years of some of these, telomeres getting longer, and so she had 2 MRIs. Her muscle mass increased. A few other things. She mentions it in the video. I'll have a link here. I believe her insulin resistance improved and things like that. Yeah,
this is what you would kind of expect. Insulin resistance, insulin sensitivity is very much dependent on muscle. What it shows, actually, is that whatever protocol was used to actually deliver these genes, it seems to have actually been effective. It seems to have actually genetically modified a sufficient proportion of cells to provide a long-term effect of actually stimulating the expression of these genes.
But you're still worried that at some point in the future, and obviously we don't know, could be already happening now, could be decades from now, there is a concern from you that it could potentially, this telomerase induction gene therapy she's had could potentially cause cancer somewhere down the road.
Well, there's two issues. There's having more telomerase and there's having done gene therapy at all.
Okay.
Because, the point about gene therapy as it stands today is that the DNA that you inject, the engineered DNA, then will integrate into the standard genome at a random location.
Okay.
And there are places that can integrate that might cause the cell in question to become cancerous, irrespective of what gene was being carried by that vector.
That makes sense. Before I forget, Liz told me to tell you hi from her, and she said, looking forward to seeing you again. And she also said very kind things about you, about how her first conference she went to in 2012. She met you.
2013. Yeah.
2013. You have such a good memory, and your then wife, and how you guys were both so kind to her, and how your then wife was very, very good at bringing her up to speed in this aging world, and that she'd never be where she was without that. So,
well, it was, yeah. I mean, that was the last of the conference series that I ran in Cambridge that I mentioned earlier on, that we've kind of rebooted with the Berlin series.
Right.
And yes, I mean, a lot of people got their first exposure to this movement by coming to one or other of those conferences. So I'm very proud of what that series achieved.
That's phenomenal. And we also mentioned in that interview with Liz Parrish that networking is really the best thing. If you can't travel to these places, if you can't actually do that, do it socially, watch videos like this, reach out to people. I'd say that the crypto community and the, anti-aging community, is that what you still want to call it? Is that what you still think is what we should be calling it?
So the word anti-aging does have a huge amount of baggage.
Yeah, it does. Yeah.
I mean, there's this thing called the anti-aging industry, which consists of products that have been around for a long time and that basically don't work.
A lot of charlatans, right?
And are obviously, yes, oversold in a very large number of cases. And so, it's been important to distance oneself from that over the years. But that's a shame, of course, because the fact is it is what we're doing. We are trying to defeat this thing called aging. The same is true for a number of words, and things can change. I mean, one thing that has happened recently, which is extremely gratifying, is the rehabilitation of the word rejuvenation, which, I named my journal Rejuvenation Research in 2004. That's 15 years ago. And I had to fight repeatedly to keep that name for the journal because it was felt to be harming the sales, essentially on the basis that rejuvenation was associated basically with cosmetics. But I said, no, we've got to stick to what we're actually doing. And now that is over. There are companies called Rejuvenation this or that. There are conferences called Rejuvenation this or that. There's an institute being started, so I'm told, at the University of California, San Francisco, which is called the Institute for Health and Rejuvenation.
That's fantastic.
Yeah, so that's a battle that we have won on the terminology side. So maybe the word anti-aging will go the same way in the fullness of time.
Definitely, and I've heard the word or the phrase regenerative medicine come up quite a bit.
Well, so regenerative medicine, of course, has always been okay.
Right.
But it doesn't apply specifically to aging. And furthermore, it does apply rather too narrowly to stem cells and tissue engineering and basically nothing else. So I kind of would like to say that what we do as rejuvenation is simply regenerative medicine applied to aging. But actually what we do is more than that, because the damage repair strategies that we use to, for example, eliminate waste products from the cell, that would not come under the traditional use of the term.
Okay. Couple other questions real quick. You wrote your book in 2007, Ending Aging. It's phenomenal. I think it's still withstood the test of time. Obviously, we've made a lot of progress since then and things have changed, but do you have any plans to write another book?
Yeah, people keep asking you that, but you've kind of answered the question. It has stood the test of time remarkably well. The progress that's occurred, as you say, there's been masses of it, but it's been pretty much the progress that we predicted. We haven't had any bad news. There's been no category number 8 of damage that's come along that we've had to come up with a new strategy for. There's not even been any case of the strategies that we had back then that are described in the book having to be abandoned because of some bad news that showed that they would be more difficult to implement than we thought. There's been surprises, but they've always been good surprises. Like I mentioned earlier, the resurgence of cancer immunotherapy, which of course was a field for a very long time, and we did talk about it in the book, but it was a field that had made negligible progress for decades, and then just less than a decade ago it exploded. So yeah, plenty of good news has happened. So the answer is basically, if I had a lot of time,
right,
I might write another book or a second edition, but I don't.
I'm very gracious for you taking your time to do this interview. We're almost finished. I'm going to respect your time. We got a few minutes left. So I think that these platforms listening to this, and by the way, I'm saying this at the end, but people complain sometimes it's long, it's a video, it's like you can just listen to this. Watching us can help see certain things, and 80% of communication is nonverbal, so I think the video helps, but podcasts are great because you can just listen to them while you're walking around or doing things around the house. So I think that what you're doing in the 2019 world that we're in with all these interviews and lectures is probably the best way to spend your time. So,
thank you. I certainly feel that It is a good use of my time. For a long time now, probably the best part of 10 years, I've spent more time doing outreach of one kind or another, whether it's interviews or lectures or whatever, than I have on the science. And that's kind of okay, because we've been able to hire really good scientists to whom I can delegate most of the work. Of course, I'm still the chief science officer here. I still oversee the decision-making process for what we fund and what we do, and I'm constantly in communication with the other scientists. But at the end of the day, it's been possible for me to do the other stuff, and I have to do it because at the end of the day, journalists and conference organisers and so on, they always want the front man. So it's not so easy to delegate that.
Okay. We got 3 minutes left. I'm going to respect your time. You've been so gracious. So I have 2 major questions that I can think of, so we'll try and keep them short. Number 1, just mitochondria. How important do you, in today's world, think that it is in the aging and degeneration process?
We haven't learnt all that much over the past 10 or 15 years about the question of how mitochondrial mutations actually contribute to the health problems of late life. But also, we certainly haven't learnt anything that makes us feel that they don't matter. So one of our major projects remains the elimination of that problem by putting backup copies of the mitochondrial DNA into the nuclear DNA in such a way that it still works. And we've made huge progress in that area. It's an approach to addressing mitochondrial problems that was first thought of in the mid-80s, and around the early 90s pretty much everyone abandoned it because they decided it was too hard. But I decided that a few years after that was premature and that we should try harder. And sure enough, after a long period of frustration, we have made critical breakthroughs, and we now are most of the way to getting it to work. We're way in the lead ahead of anybody else's even imagination, let alone what they can actually do. There are other things that we see going wrong with mitochondria. They just work less well even when they don't have mutations late in life. But we don't believe that that's a problem that needs to be addressed directly. We believe that it's the response of the cell and of the mitochondria to other things that are going wrong that we're fixing anyway, like accumulation of waste products.
Okay, so in other words, you believe that the accumulation of the waste products is what's causing the mitochondria to get young and damaged, and so
to get older and damaged.
To get old and damaged.
That's
Did I say young?
Yes.
Okay.
But not necessarily to get genetically damaged. What I'm saying is that mitochondria kind of are dialed down. They are made to. They kind of. It's an adaptive response to the damage that the cell just kind of works less well, works less hard late in life because of the accumulation of stuff. Okay.
Phenomenal. There's other things we can talk about. I didn't even get to animals that don't seem to age like humans. That's something I've been fascinated about. I normally like to ask people, things like lobsters. My wife and I are scuba divers. I've seen a massive lobster before, the ones that, and so it seems that their telomerase is turned on.
Yeah, so there's plenty that we might be able to learn from long-lived species, but actually most long-lived species are not very informative because they have different problems. In particular, lobsters grow and grow and grow throughout their adult life, whereas we don't, and that matters because if you're growing, then all your organs have got to grow, even your brain, right? Which means that you've got to have stem cells that supply more cells to each of these tissues. And if you've adopted through evolution a life course in which you reach a fixed size at adulthood, then you simply lose the regenerative capacity from some tissues, and that means that restoring that regenerative capacity is a lot more difficult than it would be for a lobster.
Okay. Last question. So I've heard you in many interviews throughout the years talk about the amount of funding SENS did have. I think around 2015 with your Joe Rogan and Brian Rose interview, it was around $5 million a year. Maybe it was $4 million, somewhere around there. Are you at liberty to say where the SENS, how much funding you guys have for 2019?
Yeah, unfortunately, it's only about the same.
Okay.
We're very grateful for every penny that we get, but the fact is it's not nearly enough. The situation overall for the field has become enormously better with the arrival of the private sector and of investors that are putting in hundreds of millions of dollars, but they're only putting those dollars into companies that are doing the relatively easy parts, not the really easy parts necessarily. That's why in some cases there are hard things that we have developed up to a particular point and then spun out. But the things that are hardest are still being done within the foundation. And the thing is, investors, even if they're giving us a bit of money, ultimately they'd like to make money, so they're not giving us much, and we definitely need more. I think we could still go a lot faster.
I mean, when you're in the multi-billionaire range, like the Bezoses, the Larry Ellisons, the Larry Page, the Google, what is a few $1,000,000? It's so you have mentioned in the past a number of times that if you took that $5 million and 10x it to $50 million per year for SENS's research budget, you believe that you could 3x the progress. Do you still feel those numbers are accurate?
It might be down to 2x, but
because we've made more progress.
Because we've
right.
spun so many things out, and so there's less that needs to be done. But yeah, it's still at least 2x.
Okay. It's just, I feel like with videos like this, and please keep doing what you're doing. Again, last I'll say, I really appreciate what you're doing. Hopefully, in some way, this has educated some new people and brought some new information to the people who are already highly educated on this, and maybe it can get a little bit more funding in some way. Because really, it's the biggest problem on the world, aging, whatever you want to call it, disease or whatever, however you'd like to phrase it. It's killing the most people per day, 100,000, and the amount of funding, $5 million a year for you guys and even the other companies, it's just minuscule. It doesn't make sense. We need to change this.
You're quite right, yes. And so thank you for having me on the show.
Thank you so much, Aubrey.
One mind, one love, one heart, one soul. One life, one chance, one head.
Let's dance inside, let's dance for a while. Heaven can wait, we're only watching the skies. Hoping for the best, but expecting the worst. Are you gonna drop the bomb or not? Let us die young or let us live forever. We don't have the power, but we never say never. Sitting in a sand pit, life is a short trip. The music's for the sad men. Can you imagine when the race is run? Turn our golden faces into the sun. Praising our leaders, we're getting in tune. The music's played by the madman. To live forever, forever young. Some are like water, some are like the heat. Some are a melody and some are the beat. Sooner or later they will all be gone. Why don't we stay young? It's so hard to get old without a cause. I don't wanna perish like a fading horse. It's like diamonds in the sun, and diamonds are forever. So many adventures couldn't happen today. So many songs we forgot to play. So many dreams swinging out of the blue. We let them come true. Forever young. I want to be forever young. Do you really want to live forever?
One life,
Forever
one love,
and ever.
one soul.
Untitled.